Let's talk about stress incontinence with running. Running can be a big problem for a lot of women. The first thing I would say is that we want to maintain your cardiovascular fitness and we don't want you to just stop running because of incontinence. There are lots of different strategies that we can try. The first thing I would say is thinking about doing a well structured pelvic floor exercise program alongside your running. One thing I see a lot with runners is that they often are changing their breathing pattern when they're running. And of course, I know running is arduous, it's hard work, so your breathing pattern is going to change, but thinking about where you distribute your air can be really helpful. So thinking about breathing into the sides of your rib cage. Trying not to breathe down into your belly or hyperventilate can be really important. So, breathing laterally, breathing out into the sides of your rib cage can be helpful, and trying to slow your breathing where possible. The next thing I find with runners is they often abdominally grip. So, they'll know or they anticipate leaking, and to try to counterbalance that, they squeeze everything really tightly, their pelvic floor, their abdominals, and that actually increases the pressure downwards. So, relaxing your tummy muscles and being more relaxed as a runner can be really helpful. I often tell my patients to let their tummies go and imagine that they are carrying two potato chips in their fingers so that their hands are nice and relaxed. If our whole body is more relaxed and we're falling into our running, that tends to mitigate some of that pressure downwards. The other thing to think about are our stride length. If we shorten our stride length and increase our cadence, it stops so much torsion through the pelvis and our pelvic floor isn't stretched so much. So, almost falling onto your legs underneath you, shortening your stride can be really helpful. If you're still leaking, you might want to think about reducing hills in your running. So, downhills and uphills just while we're retraining pelvic floor, or using a treadmill because it has a little bit more bounce. These can all be useful tips for runners, but we should be doing these tips alongside strengthening our pelvic floor. And if you aren't seeing improvements, please go and see a pelvic floor physiotherapist.